Hello, everyone. Good afternoon once again. This is Monday, August 14, 2024, and it is our last day, last week of the 2024 Medicare Mondays. Thank you so much for joining us and spending this afternoon with us. And I am your host, Dr. Prince Bill. I'm here in the studio with Miss Ruthlyn Noel Joseph. And if you have been with us over this past 3 weeks, we've been learning a lot about Medicare. And you are welcome to our episode on Medicare Mondays. So this is the 2025 edition or 2024, getting preparing us for the 2025 year. And if you are first here, please invite your friends, invite your colleagues, invite everyone that will benefit from this. If today's your first time joining us, um, we will gladly encourage you to subscribe to our YouTube channel. Our Facebook page is being streamed on LinkedIn all over the place. Share, as it reaches out to many audience who can benefit from this. I have introduced myself, and I am the founder and the chief tutor at the Hills Academy. And I am here in the studio with Miss Ruthlyn, and I'll pass it on to Ruthlyn for an introduction, and then we can kick off from today's.
Hello, everyone. Welcome back. My name is Ruthlyn Noel Joseph. I am the president of Healthways Solutions, and we are a life and health insurance boutique insurance agency that specializes in Medicare and in other health programs available to individuals as they try to navigate health insurance. I think I may have lost Prince for a
I'm
minute.
here. I'm here.
My screen was saying reconnecting, so I wasn't so sure if I was still being heard or not.
I can hear you in
Okay,
here,
great,
and I hope our audience can hear you too.
great. Okay, all right. So then we're all set. You go ahead. I think folks might have heard my introduction.
All right. Okay. So, thank you for joining us. As I said before, it is being streamed on YouTube. It's being streamed on LinkedIn. It's being streamed on Facebook. So please feel free to pass it on for our audience who have been with us over the last 3 weeks or even from last year. We appreciate the time and we appreciate all the time you spend with us. We know there are many things you could have used your time, but you are here to learn either for yourself or to help a family or friend, or even to prepare. If you are a Medicare beneficiary, you are getting yourself ready for the annual enrollment period, which is starting, Ruthlyn, this week, right?
Tomorrow,
Tomorrow,
we're like it's
tomorrow,
6
right?
p.m. right? So at
Yeah,
12 o'clock midnight.
yes. So it's gonna start immediately 12 o'clock p.m. Midnight. So this help you get ready. This help you prepare. If you are new to Medicare and you are not even at the Medicare age, or you are not you are not yet to Medicare, at least this is helping you get prepared. You don't get taught this in school, so at least you get your feet wet to be able to be of a help to a family or to a friend in this situation. And please, we have been going through several things. This is our third week this year, and today we are looking at what to expect to pay. We are looking at some of the cost and want to do a comparison. Lynn is going to take us through a comparison of the cost under the original Medicare versus the Medicare Advantage pathways. And if you're new here, we've been using the two pathways to help explain the parts A, B, C, D, and we will be going through some of them to help explain them. If you have any question, please don't hesitate to use any of the chat features that are in either Facebook or LinkedIn or YouTube, or any of the platforms that you're working with. We will get it in the studio here and we'll showcase it, and we will do our very best to answer it. If we are unable to answer it today, we will get your email or we will share our emails and we can follow up accordingly. So we want to welcome everybody for joining us today and studying with us. Um, Over the past 3 weeks, we've been going through the week one, which we did the Medicare Part D changes for 2025. Last week, and the Medicare Part D is the drug plan. So if you forget the D drug, prescription drug plans, we looked at some of the changes. The videos are on the YouTube channel, Facebook, so you can please go back and review them. Last week, we looked at the Medicare Part C, which is the Medicare Advantage changes. And today, we want to do more deeper dive to what to expect in terms of cost and comparing that on the traditional Medicare and the fee for service side. Ruthlin, anything to add on in terms of a recap? I know we have a lot of information today to share. So we want to get to the point, get straight to it. But if there are anything that you want to add on what we have
Nothing
in
at
the recap.
this point in time, no.
Nothing at this point. Okay, cool, cool. Thank you. Um, so we discussed earlier. The goal is to do a comparison of cost between the two pathways, either from the fee for service, traditional Medicare pathway, or the Medicare Advantage pathway, and look at some of the costs in terms
Mhm.
of decision making within this enrollment period. Um, Annual enrollment period. We talked about this earlier, and it's starting from tomorrow, October 15th, all the way through December 7th. So if that we've learned that the annual enrollment period is for people who are already enrolled in Medicare, and it gives them the opportunity to make the necessary changes for their plan for next year, year 2025. If you're new to Medicare, you'll be starting your initial enrollment period, and that is a whole separate session that we have a lot of videos on that. But you can look at that one on our page on the Heals Academy, which goes through the various enrollment periods. But today, starting tonight, the annual enrollment period is open, will be open, and therefore you can make the necessary changes. And we are here to help empower you, enlighten you, so that you are able to engage and make sure you make the right decisions for your for your health plans for next year, Medicare. So so Ruthlin, I'll pass it on to you as you take us through
Mhm.
the cost on the original Medicare pathway, and then we roll back to the Medicare Advantage pathway, and then we can you can educate and help us understand what other resources and help that we can also get from people like you and who are helping in this space.
Got it, got it. And I will take a little, knowing that we might have some new people, I will explain the original Medicare pathway.
Hmm.
Folks, and the Medicare Advantage pathway is when you first enter Medicare, you enroll for Medicare Part A, which is your hospital coverage, Medicare Part B, which is your medical coverage. That's where you get your red, white, and blue card. And basically, you could stay in that lane, so to speak, keep your red, white, and blue card. When you go to the doctors or you go to the hospital, that's the card that you show them. However, there are certain things that's not included here. It does not include prescription drug cost. So you would have to add a standalone prescription drug plan, which is known as Part D, as in David. So you would add a Part D plan. This will be the plan that covers your medications. And because Medicare has cost, and we're going to talk a little bit about those costs as we move on in terms of like this pathway. Because Medicare has costs, you may need what's called a Medicare supplement, or you might have heard it called a Medigap plan. But basically, this is a plan that pays the out of pocket cost that you would have to pay. It's paying that for you if you have Part A and Part B, right? So this is your Medicare supplement. It supplements the cost that is attributable to you as the Medicare member. So always remember Part A, original Medicare, the pathway for original Medicare includes A and B. So Medicare Part A, Medicare Part B, Medicare Part D for prescription drugs, and then a Medicare supplement plan. So technically, four plans that you would need to manage your costs as you deal with Medicare. All right, next slide.
You deal with the traditional pathway, right? Or
This is the traditional pathway, correct?
okay. Yeah.
right? So, what we're getting into for you is helping you to understand what are some of those costs you're going to have under the original Medicare pathway, right? The first thing I want to remind you, and we spoke about this, but now I'm showing you some of the numbers and laying it out a little differently. But the first thing I want you to know is that for Part A, the vast majority of folks coming into Medicare or with Medicare does not have a premium to pay for Part A because the idea is that you've worked for a total of 40 quarters, which is the equivalent of 10 years. And over that time, you were paying Medicare taxes. You know, when you take out your employer, give you that paycheck and you see Medicare on that, and you're wondering why you're paying for Medicare, why you're paying for Social Security. I had a young person ask me about that recently, so I'm bringing it up here. But you're paying for your Medicare through your payroll, and now you're at the age of 65, or you're retiring out and coming into Medicare, and now you're coming in premium free for Part A. So no premiums for the vast majority of people. There are some individuals, though, maybe they didn't have enough credits when they're coming in. And so they may have to pay. And as you can see, it's not necessarily cheap. But currently it's 278 and 505. We're waiting for the final numbers for 2025. But these folks will have to pay somewhere that premium, but that's because they didn't have enough credits. So one of the things that I always say to individuals, if it's the last 10 years before you think you're going to retire, make sure you're paying into the system. I tell that a lot to our immigrant customers as well, because
Mhm.
they're not familiar with the system. And a lot of times, sometimes you're working, and you're getting paid, and you're supposed like a 1099,
Mm.
or working off the books, and you don't think about, oh, I'm going to need Medicare when I turn 65. Well, I'm telling you, you're going to need Medicare. And so it's important that at least for 10 years, maybe more, but at least for 10 years, that the government is getting those taxes that you're paying, so that when it's time to qualify for Medicare, you're getting Part A free. I see a lot of folks having to pay, especially immigrants, having to pay for premiums when they shouldn't have to be paying for premiums.
Mm.
These are immigrants, and I'm talking permanent residents, US citizens, um, that's just not paying into the system. And that's what happens. The second cost that Medicare has under the original Medicare is there is a deductible, right? So before, and remember what a deductible is. A deductible is something that you have to pay for first before the insurance company pays for you. So when someone is hospitalized and they have Part A, there is a $1,684 deductible that will be in place next year. This year, it's currently 1632, so the deductible goes up a little bit. And so that's a cost that you could be hit with if you don't have a Medicare supplement to help offset those costs for you, or if you don't have coverage through if you don't have coverage through your job, that's covering as a secondary, this is a cost you will hit with. This is a, well, it's not a per monthly amount. It's how Medicare decides that 1600. So it could actually be more than that, quite frankly. Is let's say you have a hospital stay and you're in the hospital for 60 days. That's considered a benefit period.
Okay.
So if you don't have any supplements, you're going to pay that 1684. And now let's say you were in the hospital for 30 days and you don't have any readmittance in back into the hospital for another 60 days. That would be what 1684. But let's say that happened in March. You came out of the hospital, and then we're now in October, and you're back in the hospital, and all you have is just original Medicare. You could hit a second deductible because it's another benefit period is what you're in, because technically speaking you were outside of the hospital, you went to the hospital, you went home, and now you're going back into the hospital maybe for something else. So you have to really watch that deductible, and I tell folks about that all the time. You have to be cautious, and that's why if you have original Medicare, your hospital costs, you're definitely going to need a Medicare supplement if you don't have something else helping you cover those costs. So it's not a monthly, but it's a benefit period. So it's 1684 per benefit period. Do you
Okay.
understand that, Prince?
Let me clarify. And the benefit period is the year, right?
The benefit period is not for the whole
It's
year.
it's not for
It's
the whole year.
think of it
Okay.
as a 60-day window, and part of
Okay.
that, yeah. Go
Okay.
ahead. I'll let you
Okay.
finish your thought.
So let me so within a year, let's say we're taking 2025, right? 2025 enrollment period, right? Within the 2025, if I have a hospitalization that I paid the 1684 for 2025,
Hmm.
and then I'm well, I got discharged, whatever, something else happened, and I go back after that 60 days, I start paying the 1684 again, or that 1684 is
Technically
a deduct.
speaking, yes.
Oh,
Yes,
okay.
right? Because if you go back in 60 days and you're readmitted
Mm-hmm.
60 days after that first admittance,
Okay.
right? You might be going back in for something else,
Mm-hmm.
right?
Yeah.
So that's where that 60 days tied in. Now Medicare have different rates, right? So once you pay that 1684, usually for hospitalizations for day 60,
Okay.
after day 60, right? You typically don't have any costs to pay up until, right? So you're going in. Medicare has to break out the inpatient stays into
Mm-hmm.
different rates and different time frames, right? But you're
Yes.
still in that cycle. And I didn't want to get too deeply into
Too
all of the
deep into.
hospital breakdown, but in that hospital stay, that deductible would be for the first 60 days, technically speaking. After
Huh.
60 days, um, Medicare will pay, and then the individual will have no co-pays or
Co-pays
co-insurance to
for
pay
insurance.
um, up until day 150. I have to check my numbers. I'll check my
Check.
numbers in my
Okay, that's
notes in a
fine.
few.
Yeah,
Um,
that's fine.
but an individual will have to won't have to pay that amount, right?
Okay.
So this deductible applies to that initial point where you're entering. But what I say to individuals, and I think where folks get tripped up on all these numbers, yes, Medicare give you all of these days where where you don't have to pay anything, but you're still within that stay because you might be admitted and then you might be discharged.
Mm-hmm.
And then another part in the year you're readmitted for something else,
Something else.
and you're wondering, why do I have to pay again?
Okay, so it's per benefit period. So that
It's per
therefore, some
benefit period.
you as consumer, you have to understand the benefit periods that are tied to a specific hospitalization, because
Correct.
that is where that deductible that you're talking about applies to.
Correct.
Okay. Okay.
Correct.
Okay. Okay.
Right. Then
Okay.
this is just me trying to simplify a more
Simplify.
complex process.
Okay. Okay.
But yes, essentially that is the case.
Okay. Okay. Thank you so much. I hope, Miss Beatrice, you got the answer. If not, you can put it in the chat and we can continue talking about it. But yeah, thank you for your question, because it helped me also understand better. Thank you so much. All
Okay.
right, Ruslan.
Right.
Yeah.
And I've had instances where individuals, get confused by those charges, because maybe they stayed in the hospital for that full 60 days. And then here you are back. Maybe you were there earlier on in the year, and now back in we're now in October, and
October.
you're having a second hospital stay, and you're getting hit with another large bill, and you're wondering why. So that is why I always say that if you have original Medicare, just Part A and Part B, you have to have some kind of protection, whether it's a Medicare supplement, whether it's Medicaid, or whether it's secondary coverage through your job. You need to have you need to have some kind of protection to protect you from some of those costs.
Yeah. Okay. Thank you so much. This is very helpful. Yeah.
Okay. All right.
Uh.
My screen. Hold on a second.
Okay.
My screen just moved. Okay. All right. So now the second cost that we have obviously is our Part B cost.
Okay. We can move to the next slide.
Okay. And so, and the other, what you need to know about Part B is that, yes, there is a separate monthly premium that you have to pay, right? That monthly premium is $185 going for 2025. Right now, it's $174.70 for 2024. This money comes out of your Social Security check. So if you're getting Social Security payments, um, Social Security will just take the 185 out and they send you the balance. And so a lot of people don't pay attention to their Social Security statements, don't even realize that Social Security is taking that payment out, but it is coming out if you're getting Social Security. If you're not getting Social Security right now, maybe you're still working, or maybe you're still under your full retirement age, so you're not taking your payments. Um, you have to make that payment yourself. So that means you have to send a check into Social Security, whether it's every month, whether it's every quarter. Social Security tends to bill on a quarterly basis, but you have to make that payment. If you don't make that payment, you could lose your Medicare coverage. So this is highly important that folks remember that that payment for Part B needs to be paid to be able to maintain your Medicare. So Part A, for most people, premium free, but everyone somehow has to pay that 185 for Part B. Um, Now, it could be 185 if you're still working. If your income is over the income limit. So right now, that 185 is going to apply to everyone whose income is under 106,000 in 2025. This year for 2024, it's 103,000. So it's going up about $3,000. And if your income is above that, or 212 for couples, then you will have what's called an income adjustment added to the 185, and it ranges from different income ranges. If you want that information, just shoot me an email or a text. I'll be happy to send you what those numbers are, or email prints as well, or text prints. And we'll be happy to share what those income adjustment figures are for you for 2025. But know that you could be a little higher, but the vast majority of Medicare beneficiaries fall into that 185 um, monthly premium
Monthly premium.
payment. And this is a monthly premium payment as well. Okay. Then under Part B, there is what's called a deductible as well. The deductible is a once a year deductible.
Okay.
Currently is 240. Next year it's gonna be 257. So we're going up, not down. So now you're going to have 185 that you're going to pay for your Part B premium. At the start, you're going to pay that every month. And then the deductible is once a year. So you'll very likely hit it when you go see a specialist early January, February, depending on how you see your doctors. You're going to go in the doctor office and they'll tell you that, oh, you have to pay your Medicare deductible. That's what they're referring to. It's going to be 257 next year. And then with your Part B cost, every time you go see the doctor, so this, remember where we are, we're on original Medicare. So
Original.
every time you go see your doctors, you're going to be paying what's equivalent to about 20% of the cost. Now, Medicare has its own rates for certain services. So I want to say to folks, it's not the rate that the doctor bills Medicare, it's the rate that Medicare says it's going to pay for that service.
Okay.
And I bring that up, Prince, because last week I was having a conversation with one of my customers, and he was like, I am I'm so concerned, she was I'm so concerned, I'm looking at all these bills and she's showing me all the bills and the doctor charges 3,000 here for a procedure and 500 there, and she was like, "But I haven't gotten a bill yet." And I had to say to her, "Chances are you're not going to get a bill for that amount, because when I scanned her bill, I had to point on the bill, but did you see the doctor billed Medicare for 3,500 here, but Medicare is only paying the doctor 700 here and 200 here, right? So that 20% that individuals pay is based on Medicare allowable charges.
Okay.
Um, but you're only going to know that once the doctor put in their bill and then Medicare says exactly what I'm going to pay for. And then you pay what Medicare says is your share of their allowable charge. So be careful with that. And if you're getting bills any other way and you're getting billed for the standard amount that the doctor is billing, ask some questions. It's
Okay.
my my little spiel here to folks. Be your own
Okay.
advocate. Ask questions about those bills, because we do know that 80% of bills are wrong that consumers are paying.
Yeah.
So I'm gonna wrap up Part B, but so know that that deductible is once a year,
Okay.
right?
Unlike the part A, which is the hospital one, part B,
Unlike the hospital where you could have to pay that amount multiple times a
multiple
year,
times depending on the
depending on
period.
inpatient stays. Correct. All
Okay. Okay.
right.
So all the and this is original Medicare. So
Mm-hmm.
just talking to people and especially in my community or in our community, like
Right.
it's like, oh, I paid into Medicare, and therefore, once I get to Medicare, Medicare will take care of things. But these are showing that even after paying to Medicare, or as you pay into Medicare, if you're not there yet, you should be planning for other charges that is going to
Correct.
come, that you need
Correct.
to, other costs that you need to be preparing for, pretty
It's
much.
one of the myths that we tell folks. Medicare is not free. And I do not get into political arguments with folks when they're telling me that Medicare should be free. But Medicare is not free. And I think we have to expect that, there will be some costs. And all of these costs are manageable in the sense that there are other ways to help you pay for those costs. Some you may have to spend a little money on, but there
Hmm.
are other options. So when in doubt, and if the cost is really burdensome to you, ask someone, how could you save money on Medicare, on your Medicare costs, right? Because chances are you're eligible for one of the many programs that's available to help you lower your costs. But I
Okay.
thought we should do a little breakdown on that. So now you have Part A and you have Part B, and this is your red, white, and blue card.
Yep.
And now you're going to need Part D because you're going to have to fill your medications,
Your medications.
right? Um, and so now we're breaking it down into, so you have your standalone prescription drug plan, which you've added now to your original Medicare card. So this is separate. The Part D plans are sold by insurance companies that are contracted with Medicare or CMS, the Center for Medicare and Medicaid Services, to work to offer prescription drug plans. So with the standalone prescription drug plans, there are premiums, a separate premium that individuals will pay. Now, I will tell you that prices vary across the country. So folks might find a plan for may have no co-payments, no premiums, or they might find a plan for over $100. I will
Mm.
tell you with Part D as well that the devil is in the details. Um, and you may think that you're getting more if you're paying $150, and that's not necessarily the case. So Part D is very individualized. It must, when you're looking at a Part D plan, you must focus on your medications that you're taking and how you're going to use that Part D plan. I can't say that enough because people always equate price with quantity and quality.
Oh,
And
quality.
then
Yeah.
folks complain that, oh, I'm spending a lot of money and it's not working for me. If you're not on a lot of medications, maybe you're on the, regular maintenance medication, you could probably get away with a $15 plan and get your benefits covered the right way for you, right? So pay close attention to how you're going to use those Part D plans and you will make the most of it. Now, Part D comes in phases, right? I think last week and the week one,
Or
we
two,
spoke
week
about
one.
how we're getting rid of the donut hole, but Part
Yes.
D still have costs. And so once you've paid your premium, now you enter,
Yep.
if the plan has a deductible, you have a deductible to pay on your medications, right? If you're on a maintenance drug where you're paying $1 or $2 and you have a high deductible, and that particular plan does not exclude tier one or tier two from the deductible phase, you could be paying that deductible a whole year and never get out of it because
Mm.
all you're taking is one or two low cost drug. Now, where people are going to feel it most is when they're on a little higher price drug. Um, and now they know that that drug is on a tier three, and they know it's going to probably supposed to cost them about $45. But when they go to the pharmacy, they get hit with a $200 or a $300 or the entire 590 in those kind of early phases of doing that. That's the deductible at play. Understood, Prince?
Yes, I understand
Okay.
it. Yep.
Got it, right? So that's
Yeah.
the deductible that folks are getting hit with initially right off the bat. So as you're looking at your plans, think about whether or not you want to go with a lower deductible, or you could look for a plan where it will say something to the effect tier one and tier two, for the most part, are not counted towards the deductible. The deductible will start on tier three or tier four. That's what you want to look for, right?
Mm.
Because if you're using some of those low cost maintenance drugs, then you don't have to worry about the deductible. You're just going to pay the price of that, what Medicare says is allowed for that medication, or what the
Mm.
plan says that you're going to pay
Mm.
for that medication, so to speak, right?
Yeah.
So folks need to be mindful of those deductibles because we're increasing on the deductible for the last few years. As this deductible has increased every single year the last 5 years. So now we're at 590, which means that you're going to have to pay those first.
Yeah.
Now, after the deductible phase, when folks get through and they pay, technically speaking, that 590, they will enter what's called the initial coverage phase. This is now where we spend a copay for the most part. But on your tier three or tier four medications, your higher price medications, you might actually pay a percentage of the cost. So, which is called a co-insurance. But right now, this is where we're getting up to the cap, because now once you've spent that $2,000 in the, that includes the deductible and then everything else that comes after that, up to $2,000, now you've entered catastrophic coverage and you have no
No
copays
question.
to pay for the rest of the year. That's what catastrophic coverage does. You pay nothing else for the rest of the year. Of course, you have to remember to pay your premium because you're in a standalone plan, right? That
Yeah.
doesn't go away, but no out of pocket costs in co-pays and co-insurances or any more deductibles. You will have that. So if you're taking a lot of high cost drugs, you may get to catastrophic coverage very early in the year.
Quickly. Mm-hmm.
But again, the vast majority of folks with Medicare never get out of that initial coverage phase. You know, they might get through the deductible, but most people don't get out of that initial coverage phase. And I don't expect that to change for most people either
Okay.
as we move into 2025, even with the lower $2,000
No.
as opposed to eight from this year, right?
Okay.
So
Okay.
this works great. This setup works great for folks who always get into the donut hole every year, right? Because now there is no more donut hole in
Mm-hmm.
2025. So that will work great for them. All right, let's move
Okay.
on.
Yeah. So
Um,
just a recap, like looking at the traditional pathway now, looking at, so as one considers whichever pathway they choose to go,
mhm,
at least for the traditional Medicare pathway, you are thinking through part A with all the details that you talked about, which is the hospital side of things, part B,
mhm,
which is the provider
correct.
medical side of
Labs.
things.
Mhm,
Now you are adding part D uh, to track all of them with all their premium and deductibles and what they all come with together as one is making the choice of that pathway that one choose to be to go to.
mhm, correct.
Okay. So we move on to the next
Right.
addition. Okay,
Right.
Medicare supplement.
Yes. And so remember what I say about Medicare supplement. This is your Medigap plans. They only do one thing. They are there to help you with your copays and your deductibles that you would have for Medicare Part A and Medicare Part B. Although starting in 2020, anyone that comes into Medicare after 2020 no longer have access to one of the best plans in the market, which is Plan F. And so everyone, when you go in there now, will have to pay the deductible for Part B that we
Okay.
just talked about, that now 257. Everyone with a supplement will, except those that have Plan F and Plan C, will have to pay that deductible cost. And so, practically anyone that's newer coming into Medicare after 2020 also are paying that the supplement plan. They're paying the supplement premium, but they also have a deductible to pay under the supplement. I meant to put
Okay.
that there. I forgot.
Okay.
Um,
No problem.
but
So
okay.
you mentioned something, if you don't mind, or you can finish and I can ask the question.
Okay. Ask your question because it might be related to what I'm going to talk about next.
Can you explain? Because I know we've done A, B, C, D, but now I'm seeing A, B, G, N.
Okay.
In terms of the
uh,
plan type, like,
uh,
do you mind touching just briefly on
okay.
what those are?
So, Medicare is in parts, right? So we talk about Part A,
Part
Part
A.
B,
Mm-hmm.
Part C, Part D, right? Those are the
Yes.
parts to Medicare. This is the structure, the pathways we're taking.
Yeah.
Plan A, Plan B, Plan G, Plan N, those relate to a Medicare supplement,
Supplement.
and it confuses everyone, but Medicare supplements are related. So when you buy a plan, you're buying a Plan F. All Plan Fs are practically the same. They have to cover the same benefits. All Plan Gs have to cover the same benefits because Medicare supplement is standardized,
Okay.
right? So you cover the same benefits. That's why I say to folks, when you're looking into Medicare supplement, you need to just buy the lowest cost plan N in your region, right? Because
Okay.
you get the same benefits from all of the plan Gs being offered in your region. Unless you want something else extra that one carrier is offering, but the standardized benefits for Plan G is the same amongst all of the carriers.
Oh, the
All
carriers.
right. So
Okay.
Medicare supplement is referred to as plans, Plan A, and it has its own set of benefits. Does that
Okay.
help you?
Okay. That helps me.
Right.
That helps me. Thank
So
you.
when someone says to me, I have a Medicare supplement, because they usually folks will confuse Medicare supplement with Medicare Advantage. The first thing I ask them is, which plan do you have? And if they tell me they have an HMO, and then I know it's not a Medicare
A
supplement they
Medicare
have,
supplement
because
plan.
if they pull out their Medicare supplement plan, it will say Plan F on it.
Okay.
AARP Plan F, Humana Plan G. It will say the name of the carrier, and it will be called Plan, and then this letter right
On that.
afterwards. Um,
Okay. Okay.
so, so with Medicare Advantage, a Medicare supplement, what I'm going to tell you about that is that, remember, it's not its own insurance that's paying for a lot of benefits. It's only paying for your copays, your share of the cost for Part A and Part B. But the pricing is going to be vary based on your age. Males pay differently from females. Your health status, if you have to be subjected to underwriting because maybe when you turned 65 or came into Medicare, you had an initial enrollment, but you never took it, and now you're going back in. In some
Mm.
states, they could underwrite you, basically check your health status. So, and deny you a supplement plan as well. So, you got to think about this cautiously. Where you live, where I live in the Northeast in New York State, we have some of the highest rates. But if I go next door to New Jersey, the rates are not bad in terms of like the supplement, right? So all of these things put together will determine whether or not you take a supplement plan or not. But if you're staying with original Medicare, and you don't have that excess secondary coverage through your job, um, or something else that's going to help you pay
Like to
for
pay it.
your out of pocket costs, then you need to really think about not leaving yourself so
Oh.
before at my end. So you saw it now?
Yeah, it
Okay.
went out just a little bit, but came back in. But yeah,
Okay.
you were touching on that. If you don't have, if you're going on the original Medicare pathway and you don't have any supplement, any other way of helping
Of
with
paying for
the
your copays,
paying for your, then
think
this will be an advisable
think
option
about a
to take
Medicare supplement. Think
supplement.
about a
Okay.
Medicare supplement here. It's crucial that you not just carry Part A and B, because if you get hit with that hospital deductible, that could be a potential financial issue. So I always encourage folks, if you're staying on that pathway, definitely add a Medicare supplement. And if
Okay.
you're not, then we move to the other side of things, which is your Medicare Advantage plan. So now we've decided on whether or not to stay original Medicare, and you're making that decision now to go over to Medicare Advantage. What you're dealing with here is that your Advantage plan, all of those costs are rolled into one plan. So you're paying one. Um, I think folks sometimes believe that, oh, if I go with a Medicare Advantage, I don't have to pay the premium for Part A and Part B if I have those. You do.
Mm.
That's where it starts, because that is, remember, Part A and B is the thing that you think about when you're coming into Medicare. So this is your Medicare cost, really. It's coming out through your Social Security. So you will pay your premium if you have an Advantage plan. You will pay your premium for Medicare Part B. Most people don't have the Part A, so you don't have to worry about that. But you're paying your Part B premium, and then on top of that, you may have a Medicare plan, Part C plan premium. So if
Yeah.
you once you choose an HMO or a PPO plan, many of the plans are $0 premium plans,
Yeah.
but you could have a plan where you're paying $50 or $25, even 200 plus for a Medicare Advantage plan. So this is on top. So when you're doing your numbers, your Part B premium, because chances are you don't have Part A, plus whatever you're going to pay for your Medicare Part C plan. And if this is a plan that includes prescription drug coverage, it's still one price that you're paying for that plan. All right. Um,
Mhm.
Now the devil is in the details when it comes to your Part C.
See.
And this is the copays, right? Because yes, you have your monthly premiums, but depending on how often you're going to the doctors, those copays could add up. Um, and I'm saying copays here, but if you have a percentage of the cost, that's called a deductible. You might have a percentage to pay. You might have to pay 20% on some plans. If you have a, um, a PPO plan, so a preferred provider plan where you have in network access and you go out of network to doctors, almost always those plans come with co insurances that you pay, right? So that's a higher co-insurance than what you would normally pay, but you still have those co-insurances to pay.
Mhm.
Um, some of the plans also have a deductible on medical, right? So there is a medical deductible that you're paying. So you want to tread lightly with those plans because we're seeing a lot more plans coming with that medical deductible that they have to pay, that individuals would have to pay. Now, when the deductible is medical, you also have to look at a few things as to what the carrier is saying in the notes.
Mhm.
Because some of the medical deductibles, we know technically speaking, a deductible is what you pay first. But on some of those plans, the deductible is tied to a particular service,
Service.
right? So we always have to pay attention when we see a medical deductible and whether or not to recommend a plan with a medical deductible. We have to look at, is the plan um, what does the deductible apply to? Maybe if you go to primary care and go to see your specialist, you don't have to pay the deductible on the plan. But if you're having inpatient procedures or surgical procedures, or you're in a hospital stay for certain days, then that's when the deductible will be triggered. So it's a judgment call as brokers that we're always trying to, kind of limit the cost for individuals. And when we put them in a plan that has a medical deductible, um, we have to explain to that individual when the deductible would hit, right? So
Mhm.
that's a medical deductible. And overall, in the Medicare Advantage plans, what you see that you don't see on original Medicare is the maximum out of pocket cost. So the government cap those plans in the amount that you would pay in any particular year. And once you've reached that limit, you no longer have anything to pay. This is all in medical, because the Advantage plans also have a prescription component attached to it, and the prescription component follows the Part D, right? So you
Yeah.
still have a prescription deductible, you still have a prescription initial coverage phase, and you still have catastrophic coverage for physician, for prescription drugs. Those two things, they're not the same. This is why one is maximum out of pocket, and I think that's why the government just called catastrophic coverage what it is, but it's still a maximum out of pocket
Okay.
for prescription drugs. So you have those two things happening within a plan. You could reach your medical and not reach your catastrophic coverage
For part
under a
for
medication.
medication. Yeah.
Mm-hmm.
Yeah.
Yes. All right. So this is your, I know we're up against time. So this is your um, lay down, kind of like a breakdown, simplified version
Version of
of high level of original Medicare costs versus the Medicare
Okay.
Advantage costs. And so, as we do with everything, we like to say to folks, if you go that pathway, um, I think we have it twice here, but if you go that pathway, there are things that's available to help you save money, right? And don't you could always explore those options, right? We have Medicaid for persons with lower income. We have the Medicare Savings Program for persons um, who level might even be qualified for Medicaid, but they have a little bit more asset, uh, and they want to go that they don't want to go through that detailed process as Medicaid. Medicare Savings is available to them. We have pharmaceutical assistance program in your states, and know that many states also run a number of other programs to help mitigate and manage your costs. So you might want to look into all of the programs available in your state. And if you're working with a broker, they should be able to guide you through the different programs in your state, and maybe even help you to apply. My team helps all of our customers. We explore whether or not any of these programs are available to them, and we help them apply as well. In addition, and this is not necessarily a state or federal program, but for some people, especially if you have an Advantage plan, you might want to look at these extra insurance. It is extra insurance, but they're not high cost. But those are voluntary benefits: your hospital indemnity, your cancer policies, your critical illness policies, accident, and a whole range of other policies that is available. These things pay you cash. You get the cash and you use it to supplement or to lower or to use to
To
pay
pay for
your
out of pocket
deductibles and
costs.
your co-pays and stuff, right? Of course, it's tied to some kind of medical situation. So you actually have to have that, and you need to have them while you're healthy, not when you're ill. That's how they work. Right? So if you have cancer now, chances are you're not going to be able to get a cancer policy, but there might be something else there that you could get. You want to explore those, and use those, leverage those to help you with your Medicare costs, as you're dealing with any kind of health situations.
Ruthlin, are these federal and state programs applicable to either pathways, or they are only applicable to just one
They're applicable to both pathways. For
of
example,
pathways? Okay.
if someone could decide to stay on their original Medicare plan, so they have their Medicare Part A and Part B,
Mm-hmm.
um, and based on their income, they qualify for Medicaid, and they choose to stay that path, right? So they will use Medicaid in most states. The Medicaid will pay in all states, really. The Medicaid will pay for the premium for Part B for them anyway, so they don't have to do that. What I say to folks though is that you do not need the Medicare supplement if you have Medicaid, because they're essentially paying the same thing in original Medicare. I see a lot of
Mm-hmm.
people showing up with the Medicare supplement, um, as well. Yeah, I see a lot of folks showing up with the Medicare supplement as well, and they have Medicaid. Um, but I mean, you think about it, look at what you have, but I don't really think that folks really need a Medicare supplement if they have Medicaid, because Medicaid is technically paying for the things um, that
Supplement.
the
Okay.
supplement would pay for, all of the co-pays, all of the out of pocket costs, and then on top of that, it pays for the long-term care services that they need. So, um, you know, explore those options in your states. They're available um, to you. Sometimes the paperwork is a little lengthy. Ask questions, get help. There are lots of resources to help you get through the paperwork and get those services and get those costs come down for you if need be.
Yeah. I know we are it's 7 right now, but our audience, if you can lend us 10 minutes, we will finish quickly and then make sure that you got everything before this. Today's the last day. So just give us 10 minutes, and then we should be able to finish up with the all the other things that we have for you today. So um, thank you so much.
Thank you. All right. So
I think
keep
you had
going
talked
because
about,
we just discussed this one.
yeah, yeah. All
All
right,
right.
these are final
So
reminders. Uh-huh.
So these are some helpful reminders for folks. I believe that everyone should have their ANOC documents now. It's
Mm-hmm.
gonna say annual notice of change on it, or it might just say look at your changes for 2025. Take a look at those, see what's changing on your plan. Like I said, a lot of plans are changing. Um, their benefit structures. They're added in deductibles that wasn't there before. Some plans are going away. So if they are, you need to know what you need to do there. So review your ANOCs very carefully because you may have to make a decision. As you're thinking about whether or not you leaning towards a Medicare Advantage plan, you're going to want to check to see if your doctors are in network, if you're leaning in that direction. Clearly, if you have a original Medicare, you're not asking about in network anymore because it's really, does the doctor take Medicare? But with your Advantage plans, it is essential that you check your doctors. And I'm saying every single doctor that you're going to use to make sure that they're in network because that's how you're going to keep your costs down. But if you have one or two that you don't see often that is out of network, then at least you know you might be paying a little bit more to go see those doctors. But check your doctors, review your medications. I can't tell you if you want your prescription drug plan to work for you, you have to review your medicines, right? You have to look at it against the carrier that you currently have to make sure that your medications are on the lowest tiers for that carrier. And if you could get it at a better tier, um, under a different carrier, maybe you might want to consider switching your medication to someplace else where you're going to save money.
Mhm.
With prescription drugs, folks always say, I don't talk carriers because to me, it's not so much the carrier, it is the benefits that you're getting. And when I hear folks telling me that, oh, I don't like this particular over this one, that I already know there's two things that's happening there. They're having trouble either accessing their doctors or accessing their medications or paying too much. It's time for a review if you're having any of those situations. And check the pharmacies that you're going to as well, right? Some On some plans, the pharmacies they have a preferred pharmacy where you get the lowest rate. But if you go to another pharmacy, maybe a standard pharmacy, they're not preferred. You could still see them, but you might pay a little bit more just to continue to see that. So if your pharmacy is not preferred, ask the pharmacist if they're going to, you let them know that my plan says you're not preferred. Um, am I going to get the preferred rate? Right? And that way they're not billing you, they'll bill you at whatever the preferred rate is, I like I like to negotiate, and I like small mom and pop pharmacies, um, because they're small business owners and they're struggling and they're a pillar in the community. And I want folks to have access to them. And sometimes they're not on the preferred. So you do have to talk to your pharmacist. And if you're getting the benefits that you need from your small regional pharmacist, talk to them. They might have some options for you there
Emotion.
as
Yeah,
well.
yeah.
Yeah.
I think,
Oh,
yeah.
I almost forget. Yeah. And then, we went over it, but I can tell you on those advantage plans, know what your moops are, right? Your medical maximum out of pocket. It's a good number because think of this as if you're planning to have surgery and you know that you're going to have surgery, you need surgery at certain point in time in the year, and your medical MOOP is $5,000, but you have a whole bunch of other medicals, testing and all of those stuff leading up to that, when do you schedule the surgery? Do you schedule it at the beginning, or do you schedule it at the end after you've used up you've reached or close to your MOOP, so you don't have that larger bill to pay when you do go for your surgical procedure? Just think about that. You might want to schedule your surgery, if you could. Not everyone have that option, but if you could, towards the latter part of the year, because you've already seen a lot of doctors leading up to that. So when you have that surgical procedure, your copays will just be your will be what's left, right? Because once you
Yeah,
hit the MOOP, there's nothing else to pay.
you can pay.
So
Yeah,
think about that. Pay close attention. I can tell you, pay close attention to those deductibles, both on the prescription formulary as well as on your medical plans and what they're covering. And where folks have the biggest cost prints, it's when they do an inpatient hospital stay.
but
Sometimes you're seeing $300 per day for 7 days. When you start doing the math, that's almost $2,000
yeah,
or more that you're paying for an inpatient hospital stay, especially under your Medicare Advantage plans. Um, so you're gonna want to pay close attention to what those inpatient stays are, radiology, your MRIs and your CT scans that you're going to do, or I was trying to think of colon screenings. If you're having anything other than the basic, you could see some of those costs escalating there for you. So pay close attention to that. And if you're doing that, and if you're following this little roadmap, you could actually budget quite effectively how much you're going to pay for 2025, if you're sitting down in front of your plan, which have your benefit information in front of you, and you could kind of plan out and kind of get a good estimate of your cost.
how much your cost is gonna be.
Mm-hmm.
Mm. And I
Questions?
think no, no, no. I was reiterating like doing all these to know, have an idea, just as you said, how much your cost is going to be for the
Mm-hmm.
year, at least for some things that you can control.
Correct.
Yeah, that way. Yeah,
Correct. Correct.
but
I call it
definitely,
control
please.
cost.
Yeah, I
Right?
know we have 2 minutes, but please,
Yeah. Okay.
as you had mentioned earlier on with the Medicare benefits checkup that you guys are doing, if you
Right.
don't mind finishing us up with that.
Yeah, and this is something that we offer everyone in our areas that we're obviously licensed in. And then we refer folks to agents who could help them in their area if it's an area we're not licensed in. But basically, and we do this year round, right? So we do our Medicare benefits for anyone needing it year round. But during this time between 15th, which is in a few hours, and December 7th, we do offer a benefit checkup. This is your opportunity. This is a no obligation. So we're reviewing the plans for you, looking at your doctors, your medications, and fully reviewing to help you make a decision as to whether or not you need to change plan. You could stay with the plan that you have. You could probably go back to Medicare, original Medicare, and get a supplement and a standalone Part D, or the reverse, come from original Medicare, come into Medicare Advantage, just based on your healthcare needs for 2025. This is a great way to just kind of take a refresher, look up, ask questions about the plans that you have, and that you're looking for. Or just talk to a local broker. They might have something similar running where they're doing some benefit checkups for individual as well.
Yeah, and you have your the office number here and the QR code if you're watching. Either way, scan this. It will take you to a booking page, and you can easily put in some information to get to Ruthlyn's team in Health with Solutions. Or here's the phone number that you can check out with them. In terms of the benefits checkup or any question that subsequent question that you may have, in that way. So please take your phones, take your tablets, scan this QR code, take a photo of it. I think now what I learned is like you can take a photo of it and you click on it and it can take you there. So the technology has really improved. So please reach out to Ruthling's team. And how much is the benefit checkup?
How much? Zero
Yeah.
dollars.
Oh, it's for free. Okay, 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 okay. Good to know.
There
Yeah.
are no
So
costs when it comes to Medicare for any broker services,
okay, okay.
right?
So thank you all so much for being with us. The last slide has, if you have any questions, you can reach out to me, the email here, and Ruthlyn as well, with the websites and also the email addresses here. But thank you so much for joining us and being with us this 3 weeks. We've learned a lot. If you missed any of them, or you even as you make a decision, you want to go back and review the videos are on YouTube, on LinkedIn, on Facebook, and you can please reach out if you have any questions and learn. You can pick up from last year's where we went through deeper into the various Medicare pathways and even much more deeper in that way. But Ruthlyn, I want to say thank you so much for the privilege. Thank you for the time, for your knowledge, and thank you. And definitely 2025 will be here, and we know decisions will be made, and people our hope is that people will make intelligent choices with the necessary support and resources as possible, because this time can be very stressful to beneficiaries and to everyone that supports them. And our goal is that everyone get a better resources to help support them in this process,
Right.
so thank you for your knowledge and being generous in sharing with us. But otherwise, our audience, thank you also for your time and sticking around with us for the over time, and we appreciate you all. Otherwise, we will go through Medicare successfully this year, and then be ready for 2026. It was gonna come very quickly. Yeah,
Thank you for having me.
anytime.
And thank you to our amazing community of folks listening.
Yeah,
I appreciate you, Prince. I know I appreciate
anytime. You
you as
too.
well. So thank you.
Yeah, and want to do a shout out again to the Africans Immigrants Dream. Miss Beatrice was on the line, and for also sending the message out and helping working with us. And I know my wife is also in the back doing all these production work in the background. So I appreciate you two for pulling things together in the background for today to work as well. So we appreciate you all, and we will catch you all next year. Or even if you have questions, just reach out to us, and we would gladly